Okay. Hi, everyone. Welcome back. I hope you had a great feedback session. Did you have a great session? Did we get a lot of feedback? Yes. Okay. Well, I'm really excited for this plenary session and to hear the feedback from all of our partners and to hear from our leadership, too, and try to think about what we can do to address some of the feedback that was raised this afternoon. Before I call our leadership panel up, let me just make a few announcements, and I'll try not to forget anything, but I know Susan can remind me if I've forgotten something. Okay. The local partner shuttle transport is here. And if you need to use the shuttle, for this evening or tomorrow to get to the airport, please go to the registration desk. Please pick up your posters this evening after this session. All of the posters from all 3 days will be displayed. We'd like you to pick them up by 6 p.m. if you can do that. I think many people already saw this, but there is a selfie stick outside by the big sign. So if you want to take a picture with your colleagues, your friends, be sure to do that today. Very important. Many people asked us, how do we get the slides? How do I reach out to someone I met but I didn't get their business card? Please log on to the conference platform. I know some of us that were here in person actually didn't even use the platform, but we had over 500 people on the platform participating with us virtually. All of the resources will be uploaded to the platform by next week, and you will also be able to reach out to colleagues through that platform. There will be a survey coming. If you didn't get all your feedback in today, there will be a survey coming next week, and we encourage you to respond to that survey. Let us know what you liked and didn't like, how we can improve this for the coming years. Okay, let me just check that I got everything. Oh, the photo contest. I know many organizations submitted photos for that. We are going to announce a winner next week. Sorry, we cannot do it today. But please be on the lookout for that. I think it will come through the ASAP local partner newsletter. Okay, so without further ado, I am going to call up our leadership panel to the stage. We are going to make them sit on the stage for like the whole 2 hours listening to the partners. So please come up to the stage, Melissa Jones, Katie Camp, Hong Kong, Sarah Rose, and Eleanor Tampienko. Okay, and while they're getting settled, let me just quickly introduce this leadership panel with us today. I think everyone already knows Melissa Jones, our Senior Deputy Assistant Administrator for Global Health. Let's give it up for Melissa. Beside her, we have Katie Camp, who is also our Deputy Assistant Administrator for Global Health, covering our HIV portfolio. We have with us from our agency front office, Sarah Rose, who is a Senior Advisor for Localization. We are also very fortunate to have Hong King, our Office Director for Office of HIV/AIDS. And from the Office of Acquisitions and Assistance, which we know is extremely important to local partners, we have Eleanor Tampienko, who is our Senior Advisor for Foreign Operations. Okay, so the panel will be here, and we are now going to ask our local partner representatives from the different feedback sessions to come to the podium and share with us what they discussed in their room. So we will be trying to keep close to time here. Otherwise, we won't have enough time for all the discussion. So I'm going to first ask our reps from the Government and International Partner Room to come up. I'm pleased to welcome Sunday Naidi from Uganda and Dr. Botale Mosadame from Botswana.
Good afternoon, ladies and gentlemen. Both me and my colleague will be giving you feedback from our session, and precisely getting straight to the point, we'll be speaking about the strength, the challenges, and solution. And straight to the strength, under international partnership, we have realized that the international partners do bring with them a wealth of best practices and technical assistance that, for example, the G2G mechanism is right now riding on to success in Uganda. And also the implementing partners under the government partnerships have quite a strong relationship with governments at all levels, right from the community, the facilities, and at national level as well. The implementing partners actually do sit on some of these government technical working groups, and that is really quite a big strength. So I would like my colleague to come and speak more to the challenges.
Thank you very much. I am Dr. Botlhale from Botswana Developele Clinic. So we spoke a lot as a team, and while we do have a lot of strengths, we realized that there are a lot of challenges, and we couldn't just summarize them. There were so many, but we packaged them into what we could. So for our international partnerships, there's insufficient funding and prioritization of capacity strengthening in international partner budgets. So local partners can strengthen their systems. There's also insufficient funding to cover indirect costs for local partners. When it comes to government partnerships, I think as generally the consensus around the different countries is that when we are having engagements with our governments, the one question that is always the elephant in the room is the question of sustainability and country ownership of the programs. What happens when the funding ends? So as a solution, I'll continue to the solutions and she will complete. When it comes to international partnerships, we require capacity strengthening as part of all international partner budgets, a line item in their budget, and providing sufficient indirect cost support for local partners, such as through NICRAs and 10% de minimis. Thank you.
So under government partnerships, we do recommend that there is co-creation at all levels. The planning together, the international partners and the government partners should come together with the government and plan together right from design, activity implementation at all levels. And this, we hope, will contribute to sustainability in the long term. Thank you.
Can we ask questions?
Oh, okay.
So can I just get a clarifying question? So I just have a clarifying question. When you say all levels, and I see what it is in the slide. So if a G2G activity is with the central medical store, you still want it to be at all levels, at the provincial level, at the of government. Is that right?
So it does depend on the activity. Some activities may not be relevant at certain levels. So it does really depend on what's relevant at national level, subnational level, district level, facility and community level. Yeah.
Thank you.
Any other questions from the panel? No. Okay. Thank you so much. Okay, I think next, covering the M&E pain points room, I'd like to invite Patrick Owiti from Kenya to the stage.
Well-branded. You're very well-branded.
Thank you. Thank you.
Can we get the next slide, please? Okay, thanks.
Great. In the spirit of, as the implementing partners succeed, we know that the mission will succeed. And so the team discussed and came up with the following. The strength was that there's existence of clear guidance and collaborative routine data review processes, including support for co-creation and MOUs revision, particularly as facilitated by USAID missions. So co-creation, co-planning, co-doing together, co-implementation, all the good cause. The challenge was that there was lack of consistency in reporting requirements across both internal and external stakeholders, including within the agency, which is exacerbated by changes in reporting requirements and necessitates changes to reporting system. So that sometimes it's a challenge when one officer would request for this data set, and then after some time, another officer requests for this, yet they could have discussed together and request together. Solution, let's include local partners in strategic meetings that lead to target setting by being more inclusive and collaborative in coordinating targets and reporting requirements, alongside working to digitize data collection. Sometimes you may look at the data, and when you collate all the targets together, there may be more than the population. But I think that I believe that right from the onset, when the target setting is being done, bringing in the partners so that we can also contribute, then once the targets are released, then all of us will work towards achieving those targets. Thank you.
Thank you, Patrick. Any questions or comments from the panel before we? No. Okay, thank you. Okay, we're moving right along. Next, I'd like to welcome Catarina Mabawe from the Portuguese room. And Catarina is going to have help with translation.
Good afternoon, ladies and gentlemen. I'm going to speak in Portuguese to bring the feeling from the most people. First of all, I'm sorry. Vou falar em primeiro lugar em relação àquilo que é o sentimento dos parceiros locais. Dizer que, em relação aos acordos que os parceiros locais têm com a USAID, é uma grande oportunidade que eles tiveram, e dizer que isto permitiu que os parceiros locais passassem a implementar na qualidade de intervenientes e também tendo em conta aquilo que é a sua realidade, o conhecimento e a aproximação que eles têm com o governo local, os beneficiários.
Yes, good afternoon. My name is Joaquin. I'll be helping with translation. In terms of the strengthening, she's focused on the confidence that USAID demonstrated to local partners by increasing the number of awards at both sides, both in terms of the amount of the award as well, number of awards where the local partner are prime recipient, and also the investment that has been done to strengthen the capacity of those local organizations to implement the activities.
Grande desafio que os parceiros locais têm enfrentado é uma mudança do scope of work no âmbito da implementação. Novas abordagens, elas são introduzidas no meio da implementação e não há uma adequação flexível do orçamento em relação a esse scope of work.
So, in terms of challenge, the point that has been mentioned is basically after the initial scope is approved, there is an additional or increase in the scope which does not come along with the budget to accommodate the increase. And also there is inadequate flexibility in terms of negotiation between the local partner and the USAID on regarding the increase of the scope, which is not aligned with the budget.
Como solução, gostaríamos de ter uma oportunidade de negociação com o USAID, de modo que, ao longo da nossa implementação, pudéssemos encontrar as melhores estratégias de melhor implementar com estas mudanças que vão acontecendo ao longo dos nossos acordos.
So, in terms of proposed solution, it's basically create environment where there will be directional negotiation among the parties on the scope that is being increased, and also making the implementing partners being heard in terms of those negotiations.
Achamos também que é muito importante que haja uma capacitação de habilidades para os parceiros locais, para que eles sejam ao nível de parceiros internacionais. E também achamos que é importante que sejam identificados parceiros locais que tenham uma robustez para apoiar os outros parceiros que estão a começar.
Also, another proposed solution is getting direct technical and organizational support from USAID to decrease the dependence from the international NGOs.
Em relação ao governo, gostaria que passasse para o próximo slide, por favor.
Next slide, please.
Dizer que para o governo em Moçambique é uma grande oportunidade a relação que tem contratual, especialmente com o G2G, através da USAID, e dizer que permite que o governo possa implementar várias atividades que o seu orçamento geral não cobre.
On the G2G side is the opportunity of having direct funding with the government through G2G activities, as well open the window for these government institutions receiving funds, both from international and local NGOs as sub-recipients.
Dizer que também a recepção de fundos por parceiros locais e internacionais da USAID a nível dos países permite também que eles possam apoiar de uma forma direta ou indireta aquilo que é a implementação do governo.
In terms of the challenge, when it comes to G2G, it's related to delays in contracting, planning, and allocation of funds, which result in the limited time to implement the activities and also ability to achieve the expectation.
Em relação ao G2G, há um problema que nós encontramos em relação ao tempo de planificação e ao tempo da sua implementação. Enquanto que o governo faz a sua planificação antes, não está muito bem definido o tempo em que a USAID vai aprovar os contratos e iniciar a implementação por parte do governo. Isto traz uma certa limitação da sua implementação e também aquilo que são as expectativas do governo em relação às atividades que tem a implementar no ano seguinte.
So in terms of the solution is to clarify the timeline and improve the planning process to ensure timely start of the implementation of activity to be aligned with the fiscal year of the government.
Como solução, gostaríamos que a USAID pudesse estabelecer um tempo prévio de planificação e aprovação dos acordos para que o governo possa implementar em tempo recorde e de acordo também com aquilo que são os planos do governo do Ministério da Saúde. Muito obrigada. Thank you very much.
Thank you.
Any questions or comments from our panel? No? Okay, we'll keep going. Thank you so much. Okay, from the Spanish room, I'm happy to welcome Susana Longo from Guatemala. And if we can please go to the next slide.
Thank you. Hello, everyone. I'm going to provide feedback from the Spanish group, and with a lot of flavors, sabor, this group. We have participants from different countries, from the Dominican Republic, from Panama, from El Salvador, from Guatemala, Central America. Even Peru was there. So we discussed different strengths, areas of opportunity, challenges in areas such as human resources, capacity building, financial and contractual and admin processes, but at the end we decided to choose sustainability. So we think that it's a strength that USAID supports and that there are already some platforms that exist, like the Learning Lab, which really trains local partners on different topics, including sustainability, and that is really good and useful. However, there are challenges, and right now, current awards do not include time, human resources, and funds to implement the business plans that are required to be included in all our projects. And we need time to require, to really make sure that we will have all the resources for that sustainability. So among different solutions, we think that it could be included in the current awards at least 3 years of human resources and funds that enable the implementation of the business plan that has been developed by us, and make sure that that sustainability becomes a reality. And I would like to close also. We would love that next meeting would be of USAID partners with no differentiation of local. So, thank you. No questions?
Did any questions or comments? Okay.
Okay, thank you.
Okay, go ahead.
So my question is a question about what was the decision for 3 years? You said at least 3 years.
Oh, well, we think that to implement an initiative of a business plan, at least we need like 3 years. Okay. Because, well, while you develop, you get it, and it takes time. Mm. So the minimum for us is 3 years.
Okay.
Yeah.
Okay. Thank you.
Okay. Thank you.
Thank you, Susanna. Okay, so we're moving to our 50% local voice room. So I would like to invite Andrew Eshwatoa from Nigeria to the stage to tell us about local voice.
Good afternoon, everyone. Pleasure to be here today. My group, you've noticed the slides are a bit different. So we had a different task, and I was wondering why we stayed so long, and now I know why we had more work to do. We were given about 28 different good examples of practices that USAID had brought in to regards local engagement. And we're broken, these 28 good practices, we're broken into 4 categories, including priority setting and design, partnering processes, implementation, and evaluation. Our task was, 1, to look at all these practices and determine the top 3. And also look at, was anything missing from the good practices? Was anything we could add to this? Before I go, I would like to say a disclaimer. Melissa, sorry I didn't get the USAID shirt. But I'm wearing a Formula 1 shirt, but I also have a disclaimer. I don't support Ferrari. I actually support Mercedes. But the Ferrari shirt was cheaper, so I bought it. So we had 3 key priorities to look at. And some of the things that have been said resonate with what we looked at. One of the good practices that we also looked at was co-creation with potential partners, communities, and governments, G2G. It's a good practice, and looking at all 28 of them, we think they are among the top 3 for us in our group. And I must say our group had a diverse group of persons. We had about 3 subgroups. We had at least close to about 15 of them. And we had to have some sort of midterm election too to determine which were going to be the top 3. So we had some consensus building. We also looked at, it was a tough call to have a second one, and that had to do with, it was kind of a mix for us. We thought capacity building of local partners was critical. However, this capacity building should not just be once or a one-time action. It should be integrated from the beginning of the project towards the end of the project. We also looked at the need for flexibility of the budgets, availability of resources, and also including providing or increasing indirect costs as one of the key things at our priorities. The third priority was, you might notice that I left my glasses at home, so I'm short-sighted, and include more targeted opportunities for funding local partners. And also we talked about issues of restricting eligibility to locals themselves. My group noted that there is this term of partners hijacking, or an hijacking term, in which some locals or internationals, they change their nomenclature and they take in a name of a local organization and they become like a mega local organization. And invariably, they have more resources, they have more ability to rely on the HQ, and the playing field doesn't become level anymore. So I think that's one thing that we thought was important, that it is a good practice, but we could look at ways of improving it. Then the last thing we thought that might be missing, and I think this brings me to one of my high points of this conference, was when Ambassador Eugene Bogetti II was here, and talked about Ubuntu. Without you, there's no us. But as local partners, we find ourselves looking at targets and achievements, and we see the targets keep on going up and going up and going up. And funders like us when we bring out these nice graphs, and the graphs keep on going up and going up. But at what cost? That's the question. At what cost? There's a lot of burnout actually going on, even within USAID and also with local partners. But for local partners, sometimes we don't have that structure that internationals have. We can't see those early warning signs that sometimes people look out for. And that puts us at risk. And for me, I'm more passionate about this because I'm a burnout survivor myself. It's not really funny though, because for a full year, I was off this planet. I was working in an HIV program, and I got burnt out. And for a full year, I could not do a single thing. And it's a very dark place to be, and I wish none of us gets there. But local partners, unfortunately, we see ourselves working in weekends, running emails through 3 a.m., 2 a.m. We never say no to anything. Everything we can do, we meet all targets. But so, however, we thought that there might be a place, if possible, to have some sort of mechanism or a policy document at least that looks at wellness of staff, total wellness. And I said to our team, we're not talking about getting gyms. We don't want to we don't want to put gyms in local partners. But for example, leave. Our staff, who's looking at staff taking on leave, working extra hours. Somebody mentioned the fact that NOFOs come in sometimes on the 23rd of December, which means that no one's going to have Christmas. So is there any way we can align this so that at least, because at the way and the rate we are going, in 3 years' time, a lot of us might not be here because we will have burnt ourselves out. So just to say a big thank you, and I wish all of us a lovely conference. Any questions?
I can see why Andrew won the midterm election in the 50% local voice room. Okay, any questions or comments? Okay, we're gonna keep going. Okay. Our next room, we're going to have a readout from the French room, and I'd like to invite Kwaku from Côte d'Ivoire up to the stage.
Bonsoir. Good afternoon. So I'm Kwaku from Côte d'Ivoire, and I'm going to present the work of the French group. As a French speaker, my English may not be good like this from my guy, my friend. But let me take this opportunity to thank the organizer and to plead for full translation of all the section. Please. So in my group, we also have to look at the strength, the challenge, and the solution for local partners. So our strength, the first strength is that we recognize that USAID have built a huge capacity and reinforce, for example, in training, in workshop, in supply chain. I'm going to take the example for my country. USAID has built the huge warehouse in my country. It has strengthened all the chain from the higher level to the low level. I've trained all the workers in the supply chain. That is a big example and a good strength for USAID. USAID are also a strength because he hired a local staff in USAID, a local staff in every country. And with the local staff, the mission will understand the local context and can work with local partners and inform programs that will be effective in the local context. But the challenge we face, there is a lot. The group has mentioned a lot of challenge. The main one is the difficulty to build relationship with USAID and international organizations due to the language barrier and the limited relationship between local partners and the government. Alors, the main example I'm going to take is the introduction of TLD in my country. USAID come in the country with very good direction, very good directive, but the country is not aware on it. It was not aware on it. And for the introduction, we asked the local partner to go in to discuss with the government. It has been very difficult. We go and we spend 2 hours and we don't receive us. So the challenge is that for an introduction for a new direction, a new directive, we want USAID to be on the front and to discuss with the government, and after the local partner will be easy to go through the program. The high management burden, for example, reporting requirement, additional burden caused by misalignment between USAID and local government indicator and prioritize. That is a lot of job. If you want to reduce and want to align to the government orientation, it will be a very good experience we are going to win. The solution we bring to all the challenge is continuous capacity staffing efforts, including access to French translation and material, and expand to include additional technical area. We also continue to hiring local staff and improve coordination and communication between USAID, local partner, and local government. So that is the main outcome for our group, and I'm going to tell you thank you and merci beaucoup.
Thank you so much, Kaku. Okay, to bring us home, we are going to close out with the room from on local awards, which was my room, so I think it was really great. And I am going to ask Mabonisi Chumba from beautiful Zimbabwe to come to the stage.
Thank you, Kelly. And good afternoon, everyone. My name is Mbonisi from Zimbabwe, beautiful Zimbabwe. So my name means someone who helps you to see. So my group asked me to try and make USAID see a few things about award management. So the first thing really, the strength, I think the number one thing was that there was a lot of gratitude around the room about the successful transition of awards from the international NGOs to the locals. I think that deserves a round of applause. And then generally, there was a feeling that there is a deliberate effort for USAID to make themselves accessible and build relationships with the local staff, with the local partners. And USAID putting local partners forward, I think this is also linked to that. There is a deliberate effort by USAID to build capacity of the local partners. And then restricted eligibility to local IPs when, I don't think this is a strength. Restricted eligibility to local IPs when publishing RFIs and in RFPs. I think this was part of the challenge. And it's all linked with limited accessibility to information when you're comparing local IPs to INGOs. And then as part of the challenges that we discussed, I think this is where we spend most of our time, that when local partners get an award, there's an assumption that local partners understand all the USAID rules and regs, and they understand how to manage these sub-awards. And that is not necessarily true. I'm going to get to the solutions later, but I was tempted to then tie each challenge to the solution. And then number two, there is an equity gap between INGOs and the local NGOs, and I'm going to explain this a bit. So number one, when it comes to access to information, when RFAs come out, you tend to find out that INGOs have got more information, have got more access to information than the locals. Well, partly because they may have an office in Washington and we're down there in Harare in Zimbabwe, so we get the information late. There are issues to do with when INGOs were there, they used to get their disbursements in USDs. Now locals, you get your disbursement in kwachas if you're in Malawi. and you pay your staff in local currency. That means that you cannot attract the right, maybe the most skilled staff. You can't get expats to come and work on your project or so forth. As well as INGOs, they had, or they do have a lot of buffers for money, and local implementing partners do not have that. And that is tied to the next issue of funding issues. You find that in most cases there are delays in disbursements, and INGOs can manage to get that buffer money from their program development funds, and they can cushion themselves and manage to implement the program even when USAID delays to disperse funds. But local partners cannot do that. They do not have that. And I think for what the other thing that we discussed is that for INGOs, the disbursements were in quarters. But now I think to manage risk, also I think USAID is now disbursing on a monthly basis. Now if there are delays there, it means that the program is crippled. But if you have got a quarterly disbursement and the money comes, it means that you have at least 3 months to implement, and there's a bit more time before the next tranche of funding comes, and there's a bit more time also for USAID to get the paperwork in place. Now for the solutions, this is directly linked to the assumption that the local IPs understand sub-award management, prime management, and the contractual issues. So maybe before I get to that, there was another important point of the assumption that partners understand the contractual language, the contractual English in our sub-awards. And definitely there is more need to unpack that to local IPs. There's need for mentorship, south-to-south learning, more platforms like this for information sharing. And then more importantly, again, when transitioning from one award to the next, we discussed that it is important. So maybe to explain this better, there are 2 ways that awards have been transitioned. Either a new awardee is given is given an award at the end of the previous mechanism's implementation timeframe, and then they get to start up maybe at the same time as the other partner is closing down. And then in other contexts, you find that USAID will give the new mechanism an award maybe 3 months before the current mechanism ends. And then in that case, the new mechanism that is coming in has more time to set up without the pressure of meeting targets, of implementing, of enrolling beneficiaries and so forth. And that is what we are recommending, as opposed to allowing giving the award when the other partner has got limited resources, limited staff, they are scaling down. The new partner also has skeletal staff because they are starting and they've got pressure to meet targets. So we are recommending that when transitioning, give the new award time to set up without pressure of meeting targets, of enrolling and so forth. Then number 2, and this is linked to the equity gap, that we need to create more information sharing platforms, continue to build capacity of our local partners, create platforms to build trust between INGOs, create networking platforms and so forth, and more importantly, deliberately invest in capacity building efforts of local IPs. Then lastly, this is what I spoke about, that INGOs used to get their disbursements in USDs and so forth, and well, that one I think is it's self-explanatory. There's a cry from local IPs to also get disbursements in USDs and be allowed to hold USD accounts, faster turnarounds of fund disbursements, so as to mitigate implementation challenges. I think that's it. Thank you.
Thank you so much, Mbonesi, for really helping us to see. I just want to give a shout out to all of our room reps. If you can stand, let's give you a round of applause. Thank you so much. Thank you so much for representing the discussions we had this afternoon and for sharing that feedback with our leadership team. It's not easy, I think, what we asked you to do, but I think it's really important. Okay, so I think we're going to transition to the response from our our leadership panel, and maybe we'll have a little bit of time for broader Q&A. So maybe just to start out, I think we heard from all of the rooms, some common challenges that local partners are facing. Issues with language barriers, staff burnout, time and resources needed, budgets not aligning to scope, reporting burdens, a need for business investment in business development, recognition of the 10% de minimis. Can you, panel, speak to some of these challenges and what we can do about it? And really, what is the next phase? We've gotten here, we've gotten where we are now with our local partner transition, but where are we going? What is the next phase for us? Okay, I don't know, does someone want to start? We want to start with Eleanor.
Hello? Thanks, Kelly. And I also appreciate everyone's feedback because we really do want to help our partners succeed. And so a lot of the feedback that you've provided and those common themes about, we need to have more capacity building and we need to have intentional line items and budgets for that, right? The language and translations. Like, we are aware of these things and we are working on them. So I wanted to put that out there. As far as the translations, a lot of it, I think, can be done like post-award. And you've heard from Rachel this morning that we are trying to put more documents in languages. So I think she said Spanish and French and Arabic, and then they're going to roll out other languages. So it's not an overnight thing, but we are making that, we're moving with that because we know that it's important for our partners. What we are also looking at is what we're calling the last mile translation. There's a lot of discussion about this right now, but we're committed to trying to find a way to allow partners to submit their applications in their local language. And because we know that that is also a big barrier to working with our agency. So I wanted to let you know that. Some of the things I've heard, I think are really within our management control. I mean, like the sequencing of when an award starts versus and when an award ends, right? That is related to planning, right? I mean, there can be some constraints. Obviously, when we get money is always a constraint. And so, and that's just the reality of the world we work in. But to the extent that we can plan and to make that, conscious decision of recognizing that they may, local organizations may need a little bit more time to mobilize and to get their, projects ready for implementation to hit the targets, like we should have those discussions. I think this is all about the co-creation. And so, we are working and learning from you about how to do development better by being responsive to your needs. I hope I answered your questions. Does anyone else have anything to add?
So just a few comments related to that. I do think that the issue of co-creation is so important. And I just want you to think about, as you're invited and you're working on co-creation, that in that co-creation is to really talk about capacity building and the importance of capacity building that's needed as you're developing. Often when we think of co-creation, if we're working with the government or we're working with civil societies, we most talk about what the achievements we're trying to do and not necessarily what type of capacity that staff needs to reach those goals. In addition, in co-creation, you can also have a provision for wellness. In co-creation, you can talk about the needs of your staff as you're moving through that joint process. And then the other thing that I just wanted to mention is that when we think about the issues around overlap of one partner to the next, we, as USAID, for many of us, we take that very seriously. We do not want to have any break in programming, and that need to have a new partner actually have those startup costs and to be able to have time to build their team is so, so important. So I really did like that point that was made.
I really appreciated this meeting and really this session in particular because it's an example of dialogue and the kind of dialogue that reaffirms the partnerships between USAID and the government as well as local partners. It's also our commitment to improve the quality of dialogue between representatives of the local partners with the contracting and agreement officers' representatives. And so to that end, I think we've learned a lot of lessons, certainly from this meeting, but also from the years of experience that we've had in working with all of you. I know in the Global Health Bureau, there is a guidebook that we have produced as a reference manual for missions in terms of considerations when working with local partners. And there are also some additional tools that I understand will be developed and will be shared with contracting and agreement officers' representatives that specifically focus on what skills or what considerations, what ideas are needed in terms of managing those awards with local partners. And so what we're hoping for is that there is a marked improvement in the interaction, in the exchange that all of you have with USAID as you implement programs moving forward.
Any other comments on this? Sarah?
Can I just comment overall on the whole thing?
Oh, please.
Okay. Because this was a great session, but we have had a lot of good sessions this week. And I just want to say what a privilege it's been to be part of this. And especially after so many years of not having been able to gather like this, it has just been such a great opportunity to be able to meet face to face and to be able to hear your stories of your successes and to hear the ways that working with USAID can be improved. So at USAID, we use this word localization a lot, right? And so when we use this word, we use it to refer to the actions and the reforms and the behavior changes that USAID as an agency can take to make sure that its work is more responsive to local partners. I feel like I'm echoing. Am I echoing? Okay, good. That's just me. All right. So because of that word, this has been a really great opportunity to hear from you about how some of those changes need to look. And localization is a really key priority of USAID's leadership, and they are really eager to hear about all the conversations that we had at the meeting this week and what we discussed during our time together. And I have a lot of things to take back. I'm really glad we have this slide deck from the feedback session. I have 27 pages of my own notes, I counted. I'm not gonna highlight all of those things here, but I do wanna highlight a couple of things. So first, again, these are some of the points that I heard repeatedly, is about capacity strengthening. And capacity strengthening in the service of building sustainable organizations, not just in service of implementing a specific project. And capacity strengthening as a process, not just of training, but of mentorship and accompaniment and coaching, tailored to the priorities and the needs of organizations themselves that they themselves identify. So just a couple of weeks ago, USAID released the first of its kind, a new local capacity strengthening policy, and it reflects these very principles. And so our challenge now is to put that into practice. So indirect cost recovery, this is really important. That's what I heard, it's really important. So we're working on expanding options for this, and it needs to continue to be a priority. The third is language, right? So as USAID works to make itself more accessible to the local actors that we work with both now and local actors that we might want to work with in the future, language accessibility is really important. The panel this morning mentioned that binding legal documents will probably have to continue to be in English, but we are actively looking at ways that we can expand our translations and create more opportunities for people to be able to engage with USAID in the languages that are more widely spoken in the places that we work. I also want to mention too, just because the representative from the French room mentioned the local staff that are hired at USAID missions and that role too in terms of accessibility as well. And we are actively working on both expanding the number and the roles of our locally hired staff in missions as well as a key part of localization. The fourth thing, co-creation over and over again with communities, with partners, with government. Before programs start, during implementation, and all about measuring and evaluating results. The fifth is partnerships, and partnerships are important, including in some cases with international implementing partners, even as the role of these international partners may evolve over time to be more of a supporting role. The sixth is about timing, and timing matters. You need more time to respond to RFAs, more time between finalizing an agreement and starting an implementation, and you want a lot less time waiting for approvals for things like work plans and waiting for disbursements. And then the seventh thing I think, and this sort of brings it back to what I was talking about in the beginning, is that, I think one of the big lessons is that opportunities like these for learning from one another with open questions and answers and opportunities for casual conversations are really important. And so I do want to take this opportunity to thank very much the organizers from the Global Health team who put so much effort into this because it was really a valuable experience. I'm almost done, I'm taking too much time. The main message, this is the thing that I heard this week, right? Is that local actors, they are here, they are doing this work, and that more awards should be given to local actors. And that in all types of awards, even when local actors may not be prime partners, these relationships between and among partners must support local actors to take the lead to address local challenges. So those messages, I have to say is just yes, right? So PEPFAR has committed to working directly more with local partners. USAID's administrator, Samantha Power, has committed USAID to shifting funding and shifting power to local partners. And we have made progress, and we also have a very long way to go. We are on this journey together, and we need you to hold us to account for fulfilling our commitments. So thank you for your partnership. Thank you for your honesty and your openness during all the conversations that we've had this week. And thank you most of all for the work that you do, the powerful and very human work that you do to improve health and improve lives.
We have some time. I want to open it up for the audience to raise anything. I know you weren't shy in the feedback sessions. I know the folks from Cameroon are not shy. I want to open this up. If there's something that a delegate from local partner organization or a USAID staff wants to raise in this forum, just to have people here, to have our leadership respond, I welcome you to come to one of the microphones here. I did want to say in our room, the local award room, one idea that came up that I thought was really powerful was this idea of more south to south, I guess you could call it, exchange. So local partners mentioned that they want to learn from other partners that have kind of been already down this road. And even I think someone suggested having a mentorship program. I wish I could. Was it you? It was a really good idea. Yeah, do you want to speak to your idea on the mentorship program? Sorry, I'm going to put you on the spot.
Thank you very much. Good afternoon, colleagues. Good afternoon, leaders. My name is Dr. Marina Angelekela from Tanzania. So my idea was, we have local organizations which have advanced a bit in terms of strength of financial management, organization, leadership, governance, and the like. So in the same country, for example, as you are aspiring to give more awards to local partners, you shouldn't hesitate to do so, because there are local organizations within those countries who can act as mentors and take a hand of these new local partners For example, for a year, you can attach them for a year to these stable local organizations, and after a year, they release and they keep looking at them. I think with that, you can have more confidence to release these funds to younger local organizations. That was my point.
Do we have any other speakers? Oh, I see Uganda back here.
Thank you so much. My name is Sarah Akatkunda from Uganda Protestant Medical Bureau. I shared our transition story yesterday, and it was actually possible in 1 month and successful. So my guidance is that if the transition process can be documented and the standard operating procedures done, documented and disseminated to the partners who are transitioning, it would be easier. Because they fail not because they don't know what to do, but they don't know what to do first. Second, they don't know that order of doing things. Even more so, they don't know what they should do. Those collaborations, those, what are they called? Okay, collaborating with different stakeholders and engagement of the people who are relevant to the transition processes. There are so many players who can help in the transition: Ministry of Health, USAID, missions in different countries. There are so many districts, there are so many stakeholders. So they need to know the process. If I am transitioning today, what should I do first? In how many days? What should I do next? What should structure changes to manage that big funding within the organization? What should change? Those functional units, creation of directorates, many, many things. So I believe if they are documented and put on paper, they can guide the transitioning partners. Thank you so much.
Okay, anybody else?
Yeah, my name is Madaritsu Maganga from USAID Malawi. Very excited about this, the agenda, the topics that we've gone through. You have no idea, we like something ready to explode when we go back. But we want our energy to be correlated with the tone at the top. Thankful to the webinar on localization that happened a few weeks ago. We just want to request that the same momentum that we have here and the same message could be echoed continuously at various leadership forums, so that if our energy and their leadership is combined, we can really make a difference to make these local partners, to put them in a position of power in terms of money, as well as their position at the table. Thank you.
Okay, I'd like to ask our panelists to make a few closing remarks, and then we've got a round of thank yous to do as well. Did I miss somebody? Oh, yeah. Do you want to start, Melissa? Okay.
Well, thank you, everyone. Am I on? Okay, great. Thank you, everyone. It's great to kind of be here with all of you as we think about the closing of this important meeting. What a successful meeting it has been. What a wonderful week to meet all of you. And I want to really thank the organizers of this meeting, the planners, the conference company, of course, the people of South Africa, USAID South Africa, and then, of course, all of you. The meeting, we had 283 local partner delegates representing 189 unique organizations from 52 countries that were here this week. On top of that, we had 525 individuals who joined virtually. Just absolutely amazing. I also want to take this moment to thank the ambassador for the United States of America to South Africa. What a wonderful opening that he gave. And I think it really reflects the interests of all of us in really on this issue of localization and how we work together to support the people in the countries and where we work. Our partnerships, the partnerships between USAID and local partners, have come a long way since we first began this journey together to end HIV, to reduce maternal and child deaths and prevent infectious diseases. And with every journey, there is times when the roads are straight, and then there are times when the roads are very windy. They have holes in them. You may not necessarily be able to find your way. But what I've seen over this past week are there have been signs up to direct us. The signs say things like localization. It says things like co-creation. It says things like indirect costs. All of these signs make us stronger together. And for us at USAID, we know to achieve our success will require locally led responses to ensure that the solutions are equitable, inclusive, and sustainable. This week, I learned that firsthand. And we also, this week, amongst a group of us at USAID, would like to announce a few things that we are going to do differently as a result of your comments, your inputs, and your direction and leadership. In terms of unique entity identifier, we know that this has been a problem. It's been a problem for you all to register on SAMS. That is very difficult. So we heard you. So as a result, our capacity strengthening contractor will host a focused webinar to help local partners register in SAMS. So you can see this coming in the future. In terms of indirect costs, the Global Health Bureau will work closely with our Office of Acquisition and Assistance. And while we may not have the solutions right now, we know that we need to return to Washington and really come up with some ideas to deal with these costs that you all so need and that many of you have not accounted for. Additionally, the Office of HIV/AIDS will continue to offer indirect cost training to local partners through our contract mechanism, ASAP2. In terms of business development, we know that many partners are interested in organizational sustainability. To help address this, ASAP2 will be starting up a business development community of practice and a series of webinars on organizational sustainability. And then we heard that many of you would like to have more meetings, smaller meetings, to discuss localization, to do more around coming together as smaller groups. So we are proposing that next year, we'll support smaller regional meetings that will bring together local partners from across the health sector to share best practices, operational and technical strengths. Now, partnerships with government. We heard this week how crucial partnerships with governments are to sustain our health work and mutual health objectives. USAID's Global Health Bureau's leadership is committed to include government-to-government partnerships in our localization agenda, and we'll share more as this rolls out. So, in closing, I have been blessed with sharing this journey with all of you. It has been great for me to see old and new colleagues alike. I was greeted by a former colleague, Dr. Dennis from ANECA, the African Network for the Care of Children Affected by HIV/AIDS. And when we first met, it was in 2005, when we were cutting up adult medication because we did not have pediatric formulation for HIV. Today, only one single pill with dolutegravir is needed. So we have come a long way, and we have come a long way together. And more importantly, we don't see the rates of mother-to-child transmission of HIV that we did those many years ago. Dr. Dennis, I so much appreciate your leadership in this area. And last night at the dinner, I have now met new friends, new people. Jeremy Sikazwe, who works to strengthen public health systems in Zambia. And then my newest friend, Absulmad Salahu, from Society of Family Health in Nigeria, who works to improve health outcomes by ensuring communities have access to affordable, quality, and gender-sensitive services. Yes, this has been a great week for me. It is wonderful to see so many of you so dedicated, so committed to the work that you do. And our jobs as USAID is to give you the tools for you to continue on that journey with all of us. I believe that working together, nothing is impossible. Nothing is impossible. So I want to thank you from the bottom of my heart, and to localization, Ubuntu.
I believe we have a few more closing remarks from Han and Katie. Is that right? Do we want to, Han, do you want to go first or Katie? All right, we'll end with Han and we'll have Katie.
Clearly no one wants to follow Melissa, so lucky me, she said it so well, and I have a bunch of little notes that I'm going to go off of. I want to start by saying something that if I've worked with you before, I often say feedback is a blessing, right? Feedback is a blessing. And this time together, and especially the sessions that we just had now, are critical to how we move this work forward together. And I think it was the Portuguese team that mentioned bi-directional, right? And I think that's exactly what this is meant to be. It's bi-directional and a continued dialogue throughout our implementation. And I think what really matters now, I mean, we've had great discussions, I've learned a ton, I hope other people have learned a ton, but it's what happens next, right? So I think we have to take this energy, take this partnership, and make sure we actually put it to use. And it's hard, right? We'll all go back home, it's tiring, we don't have the same people in the room, but I hope that's where our focus can be. We've talked a lot about data and numbers, and we want to get the 50%, like our local voice group talking about meeting these targets. And while that's really important, I want to take a moment and just talk about the technical caliber that we've seen here this week as well, right? So a lot of the presentations that we've seen, the engagement we've seen, the questions that people have asked. end up often judging people's intellect based on the questions they can ask. And that type of engagement that we've seen has really showed us that we don't want to engage with local partners because that's the right thing to do or because it's going to help us meet our metric in Washington. We want to engage with local partners because you're the best people to do the job and to get the work done. So thank you for that. Thank you for all the engagement and questions. It's really been terrific to see. And I think Callie and Debbie mentioned more than 200 abstracts were submitted for this. We have a number of posters out there. We had a number of sessions. So really, really terrific. I think lastly, I will just say a huge thank you. This is my first engagement like this as part of USAID and part of this broader community, and I just feel really, really fortunate to have had this opportunity. I'm almost at my 1-year anniversary, so pretty early in my tenure, and thank you, thank you.
Once again, Dumela Sani Bonani, and good afternoon, everyone. And good morning, and good evening, and good afternoon to those of us, to our colleagues who are joining online as well. When we use the terms localization or locally led development, it certainly means having this community of local partners implementing activities, delivering life-saving services for people living with HIV or other health conditions. But it also means something very special within USAID. Earlier this week, actually yesterday, in USAID, we celebrated Worldwide Foreign Service National Recognition Day. And to me, that's what localization also means. And I'm glad that one of our colleagues from the French room recognized the critical roles that our Foreign Service National colleagues play in defining development, in working with you to implement health and development activities. And there are actually 3 individuals who I've spoke with this week who I would like to recognize in particular. So Tembeka, based in Southern Africa. I just want to thank you for your efforts in guiding the HIV/AIDS response in Angola by yourself for the past 3 years. Amazing, thank you. Next, Mikhail from the Philippines. You started the HIV/AIDS program. In fact, USAID's support to the national HIV/AIDS response in the Philippines. And you continue to break ground and emphasize the important role of both the clinical and the community dimensions of the HIV/AIDS response. And just wanted to let you know that you're doing a great job, and we're absolutely here to support you as well as the Philippines team. And Giovanni Melendez from Guatemala. So I first saw you in the agency's LGBTQI course, so you are famous certainly within USAID, but also I really appreciate how you continue to be the voice of key populations, and not just in terms of their health needs, but also their broader needs around political rights and civil rights and socioeconomic fulfillment. And I really appreciate your advocacy, which exemplifies the advocacy of really our local partners as well in creating that safe space for members of key populations and people living with HIV to access health services as well as educational opportunities and employment opportunities. So I began my original comments around the theme of dialogue. So for those local partners who are implementing activities supported by the President's Emergency Plan for AIDS Relief, there are 3 opportunities for dialogue that we really need your voice. The first is the review of your Q4 fiscal year 2022 performance. There will be a series of calls and meetings that will take place in December by country, and we need to make sure that your accomplishments in fiscal year 2022 are reflected in the best ways, in the clearest ways, across the US government as we discuss how we are supporting and how we're making progress in the national HIV/AIDS response. So please work with your contracting or agreement officer's representative, with the HIV/AIDS team in the missions, in the countries where you work, to have those accomplishments well represented. Second is that Ambassador Nkengasong, following World AIDS Day, will issue the draft guidance for country and regional operational planning for public comment. So this is your opportunity to provide direct input in the guidance document that shapes how the operational plans will be developed, will be formulated. And so we really look forward to your insights on how that guidance document should be revised and should be created. And finally, the third is the actual process of the country or regional operational planning itself. So this will take place over 10 weeks in February and in March. My USAID mission colleagues will be working very closely with you on defining the interventions and the budgets that are needed to implement those interventions. And so we really look forward to your engagement, your insights, your input, certainly into the plans. And we're absolutely committed as an agency to make sure that you have the resources that you need to continue supporting the HIV/AIDS response in your countries. So with that, thank you very much for your participation in this meeting, for the work that you continue to do every day in saving lives and in making the difference that we need to see in order to ensure that we end the AIDS epidemic as a public health threat by 2030.
Thank you so much, Han, Katie, and Melissa, and for all of our panelists for all your remarks. We are almost done. I just need to thank a few people by name for all of the amazing work and support that they have given working around the clock for this conference. So I'd really like to thank the conference company, Janine, Nina, Camera, Sasha, you probably all know her because she did your travel, Tandeki, Joe, Joanna. I'd like to thank the ASAP team. And if you guys can stand too, don't be shy. I'd like to thank Susan and Catherine. We had amazing IT support here. Justin, Wade, Lloyd, John Luke. So thank you so much. Thank you to our translators who were here. I would love to thank the hotel, Carmen and her team, for all of the work and all the support the hotel provided. I would love to thank my team, Lindsay, who unfortunately I think is not here, Lindsay, Courtney, Latham, Leah, Debbie, the whole team. I'd love to thank our GH and OHA and agency leadership. Okay, and finally, to close, we have to thank the local partners. We have to thank you for all of the work you have done. For putting your countries first, for sharing that, for sharing your feedback with us. We are so grateful. Thank you so much. Okay, that's the end. That's it.
And just quickly, let's thank Callie.
Oh.